Everyone, Dr. Mouse again. Got another question of the week, if you want to call it that. And the question is that what's the difference between a breast lift and a breast lift with an implant? And what are the benefits between each? So I think the breast lift surgery is becoming more and more common in request, just as society seems to kind of go away from these very large, full-breasted desires that like in the 1980s. Now it's kind of become more of a natural kind of proportionate look for kind of proportion of your breast. And so some women feel like they've deflated a lot from children or weight loss. I don't know. They deflated and they want a little bit perkier breasts. And it's really about the shape of the breast. Like the areola is a bit lower, it kind of have a hang. And so a breast lift, what it does is it lifts the areola back in the center of the chest and over the breast mound. That typically is removal of skin only. That's what breast lift surgery is. It really is a skin altering surgery to reshape the breast. So there is no volume reduction actually. Your cup size will stay the same. Nothing changes. It's just your breast is a little bit perkier, but the volume is essentially the same. There's minimal volume removal, just skin. It's like maybe 15 cc's max. But your shape is prettier and it kind of stands alone. So in my practice, patients who come to talk about specific for breast lift, they're like, I want a breast lift. I'll tell you that the results they want is actually with an implant. I cannot give a result of a breast lift with an implant with the breast lift alone. Never happened. And the reason for that is most women want a little bit fullness of the upper part of the breast, a little bit more of a rounder shape. Nothing, it doesn't have to be extreme, but they want that fullness. Breast tissue alone will never do that with a breast lift. It's still going to be a little bit, it'll be sloped down, a very natural slope. But women who are seeing pictures online for looking for breast lift, typically you're looking at a breast lift with an implant. And these implants don't have to be big to kind of give you that fullness. It can be very small, just enough to kind of give a little bit of a push in the upper part of the breast, and it gives you a nice fuller, rounder fullness to the breast itself. So, women who, again, deflational change, they have multiple children, they deflate, lose breast tissue with breastfeeding or just multiple pregnancies. It happens sometimes, okay? But a breast lift alone will kind of it just tightens the breast. It doesn't give you volume enhancement. It doesn't give you a shape improvement of the upper part of the breast. And so breast implant, a small implant, will give you those fuller, rounder breasts. So that you can wear like a strapless or sundress and everything's kind of stand in the center of your chest, and the idea is for your breast kind of stand alone and look great at all times. So that is extremely common for me. At least 9 out of 10 women who come in for breast lift alone, we talk about the option of what a breast implant can do, and I show them pictures of what a breast implant can do, and then that's what they end up deciding. So if you have any questions about that, give me a call. Love to see you talk about it. Thanks for following.